My name is Sarah Hinton, and I'm a MedPeds physician with Prisma Health, and I'm the MedPeds Residency Program Director at Prisma Health in Greenville. We have a broad and comprehensive MedPeds curriculum, and our residents will come from this program feeling fully like an internist, fully like a pediatrician. They are well qualified to work in the outpatient setting, in the inpatient setting, or to go into specialty tracks or fellowships.
So our experiences here in internal medicine and pediatrics are split almost 50-50 every year. That looks different whether it's your intern year or your second year or your third year. However, they do a really good job of getting you both inpatient and outpatient experience.
The resident experience from year to year changes based off of just your responsibilities and the expectation that you are going to have different roles. We
split up our time in the pediatric floor or the wards, the internal medicine floor or the wards, as well as outpatient setting, and then also ICUs. And so, I think we're one of the few training programs where you do NICU, which is neonatal ICU, PICU, which is pediatric ICU, MICU, which is medical ICU, followed by all of the floors and the outpatient setting. And so you're immersed into every single one of those arenas.
As an intern, you're expected to really learn the basics, learn how to communicate with your patient, learn how to really try to take ownership over your patient, but you're doing that with the safety and with the backing of an upper level as well as your attending.
Our MedPeds residents also get to work alongside our specialty trained MedPeds physicians. This includes adult congenital heart disease, adolescent medicine, rheumatology, and primary care sports medicine.
When you get into your upper level role as a second year and a third year, you're really learning how to manage a team. And also, how can you try to be an educator? And then by fourth year, that's kind of where everything clicks.
One unique thing about our program is our MedPeds hospitalist program. At Greer Memorial Hospital, which is just a short drive away from our main teaching hospital, there is a hospital that's run entirely by MedPeds hospitalists. Our residents have the opportunity to work out there, and during the course of one day, you may start your day in the newborn nursery and then go care for an adult patient in the emergency department, and then go care for a patient in the intensive care unit who may need procedures. And you'll do this all while working alongside MedPeds trained physicians.
And we are basically the person who's running the hospital. We're taking care of the patients there. We are having our own patients, and we're acting as if we're in an attending role.
The culture of the internal medicine and pediatric program here is one of immense support. I'm very close with my program director, also with our program coordinator, and the word I can use is just family.
One of our mantras here is to never struggle alone. And so I call on my co-residents all the time whenever I have a question about patient care, whenever a question about what to do in a situation.
Upon graduation, our residents are well prepared to practice as outpatient physicians, hospitalists, or pursue fellowship training. And when you look at our graduating classes, they've done those three things about equally. Many of our residents choose to stay in the Greenville area to practice. It's a really great place to live. And many of them choose to stay with Prisma Health upstate. MedPeds is really a part of the fabric of Prisma Health, and we have many MedPeds physicians in leadership positions throughout the health system. This really ensures that MedPeds is not just an afterthought here, it's a part of how we provide care for our patients.
I think the administration here and just the culture around internal medicine and pediatrics training is very unique. We're always encouraging and pressing each other to get better.
And I believe it helps make sure that we reach our ultimate goal here with the MedPeds program, which is to make capable and competent physicians who are educators, pour into the community, and never forget why they went into medicine or who they are.